Diabetes and macrovascular disease. This presentation is geared towards patients, people who may or may not have a medical or science background. I discuss the basics of keeping our bodies free from cardiovascular disease at the cellular level, the risk factors that make that challenging, and how to improve that. I felt it important to focus on what is going on inside the vessels at ground zero, because when we know more, we do better. I've included a couple of my own mnemonics because I feel if we retain some of the information, we are more likely to work on it. Diabetes mellitus is a chronic disease which is described as a state of raised blood sugar, also known as hypoglycemia, associated with early death. Hypoglycemia seriously damages many of the body's systems, especially the blood vessels and nerves. Macrovascular disorders are the main causes of illness and death in patients with diseases that involve the cardiovascular system. For example, atherosclerosis, which is hardening of the arteries, and diabetes mellitus. The most significant macrovascular complications of diabetes include peripheral vascular disease, involving the large vessels going to the limbs. The legs predominantly are affected. Coronary heart disease, involving the vessels of the heart. Cerebrovascular disease, involving vessels of the brain. Early macrovascular disease is associated with a waxy surface covering known as atherosclerotic plaque in vessels supplying the blood to the heart, brain, limbs and other organs. Late stages of macrovascular disease involve complete obstruction of these vessels, resulting in heart attack, which is myocardial infarction or MI for short, stroke, claudication, which is calf pain, and gangrene. Approximately 40% of all ischemic, reduced blood supply strokes are attributable to the effects of diabetes alone or in combination with hypertension, which is high blood pressure. Approximately 33% of patients with diabetes experience heart disease or strokes, and about 26% of diabetic patients 30 years old or more have peripheral vascular disease. 80% of patients with diabetes die of a blood clot, and 3/4 of these are as a result of heart attack. The remainder are the result of stroke, that is a CVA or cerebrovascular accident, and the combinations of peripheral vascular disease like gangrene. This is an illustration on the left-hand side of a nice, clear human artery, and on the right-hand side an artery narrowed by atherosclerotic plaque. You can see the left-hand vessel. It's got a nice, clear, smooth endothelium. The endothelium is the lining of the vessel, and blood, as you can imagine, will flow through this vessel unperturbed, bringing oxygen and nutrients downstream to the tissues and vital organs. On the right-hand side, unfortunately, the endothelium has been damaged, and we can go into that in a little later, but the damaged endothelium subsequently has a build-up of this atherosclerotic plaque. The plaque itself is actually, as you can see with just the little illustrations here in the center of this yellow mess, it's a jumble of cholesterol, cells and debris, and it creates an actual bump on the vessel wall. As atherosclerosis progresses, this bump gets bigger, and when it gets big enough, it can create a blockage. This process can go on throughout the entire body, and as a result, not only is the heart at risk, but the person is also at risk for stroke and other kinds of health problems. Atherosclerosis usually causes no symptoms until middle or older age, but as narrowings become severe, they choke off blood flow and can cause pain. Blockages can also suddenly rupture, causing the blood to clot inside the vessel at the site of rupture and cause blockage downstream, so you get something like a heart attack or stroke. In this example of peripheral artery disease, the blood supply to the foot is compromised because the lining of the artery has been clogged up with nasty, fatty, atheromatous material over time. The diameter of the vessel is thus reduced, and in addition to possibly having calf pain, the nerves may be damaged and the patient will be at serious risk of gangrene and possible eventual amputation. So the illustration on the left is of a healthy foot with a healthy blood supply and intact healthy nerves. You can see the blood vessel is nice and wide bore, which means that the blood can flow to the tissues. The right hand illustration indicates a cross-section of the artery, and you can see that the diameter of the inside of the vessel is significantly narrowed, which means there's going to be less blood flow. You're going to have less oxygen and nutrients going to the tissues, and so they're going to get damaged over time. The nerve is also damaged over time, and so this person is at very high risk. Here we can see photographs of people's feet which are affected by peripheral artery disease. The blood supply is compromised, as you can see, to the tissues, and the skin is thin and shiny. It doesn't have normal nail growth or hair distribution, and in this situation a person is prone to open wounds which are slow to heal, and if the situation worsens, critical ischemia is what it's called, and it may require amputation. Peripheral vascular disease of the leg vessels is initially recognized by exertional leg pain that can progress to rest pain and ischemic ulcers. And here you can see just above the knee there is a narrowing, an atherosclerotic narrowing, which means below this narrowing there's going to be compromised blood flow. And here we have an illustration of the calf muscle, which is the usual muscle involved in claudication. This is a picture of a person's foot. This person has chronically compromised circulation. The skin is discolored, hairless, scaly, and on the underside there is a nasty ulcer on the sole. It's quite a dangerous situation. This illustration shows another example of macrovascular disease. A heart attack occurs when the flow of oxygen-rich blood to a section of the heart muscle suddenly becomes blocked, and then the heart cannot get enough oxygen. If the blood flow is not restored quickly, that section of the heart muscle begins to die. This slide illustrates cerebrovascular disease that is affecting the vessels of the brain. The third example of macrovascular disease complications is stroke. This is a sudden loss of brain function caused by an interruption of the blood supply to the brain. A clot in a vessel supplying the brain may cause a stroke. A TIA, in other words, a transient ischemic attack, is like a warning stroke where the blockage is temporary, usually less than 24 hours. The macrovascular complications of diabetes result from a number of things, including hyperglycemia, which is high blood sugar, dyslipidemia, excess bad cholesterol, and insulin resistance, diminished ability of cells to respond to the action of insulin. It is worth mentioning dyslipidemia here because of its high association with hardening of the arteries. Up to 97% of patients with diabetes have dyslipidemia, that is high LDL or bad cholesterol. Even the structure of LDL in patients with diabetes is slightly different. It's more likely to cause plaque. It is smaller, denser, more susceptible to oxidation, which I will explain shortly, and thus more prone to clinging to and penetrating the vessel wall. These dense LDL particles are prone to getting oxidized. And that is a chemical change where, simply put, an electron is lost, the particle then looks foreign in the vessels. This attracts the white blood cells, also called leukocytes, which eat the LDLs, and then they sneak into and underneath the endothelial cells lining the vessel. Plaque is the result. And just to recap before moving on, the artery wall consists of 3 layers. A strong outer layer or covering made up of connective tissues, collagen and elastic fibers. This is the outside of the vessel. The middle layer consists of smooth muscle and elastic fibers. Then there's the innermost layer made up mostly of endothelial cells. That is the all-important endothelium, the lining of the vessels. It is the endothelium that is at the coal face, lining the vessels in direct contact with the bloodstream. The force or pressure that it is under, the high blood sugar, maybe elevated insulin, atherogenic lipids, the bad cholesterol, and toxins such as nicotine in smokers. These factors act on the endothelium. This is a very important point, and people with diabetes or at high risk of cardiovascular disease need to know about this very important, highly active inner skin. Most people look after the skin outside the body, protecting it from the elements, nourishing it, keeping it in the best condition possible. Why, you may ask? It's because we and others can see it. It is important to focus on what is going on at ground zero inside the vessels. It's all very well to pontificate, fix your blood pressure, lower your blood sugar, stop smoking, take more exercise, but unless we can visualize where, why, and how the damage is being done, rendering the advice is futile. Again, when we know more, we do better. The endothelium is made up of 6 trillion endothelial cells, which account for about 1 kilogram of an adult human body, similar weight-wise to the liver, and line up inside the blood vessels in a single layer from large arteries to tiny capillaries, stretching 60,000 miles. So the endothelium is spread thinly through the blood vessels. It is one of the largest organs in the human body, and it is crucially important for cardiovascular health. It used to be thought that this layer was like a cling film lining, but now we know some incredible things about this organ. The main job of endothelial cells is to provide a barrier between the blood and the rest of the body tissues. Blood must be contained inside transporting vessels, but substances need to be able to move in and out in a controlled manner. The endothelium provides this selectively permeable or porous layer across which chemicals and white blood cells move according to where they are needed. Endothelial cells act a bit like a sieve, restricting the passage of large molecules, toxic substances and bacteria into tissues and vital organs, while allowing necessary molecules like oxygen, enzymes and hormones to go through. They also allow waste substances like carbon dioxide produced by the tissues to diffuse back into the blood. Under normal circumstances, blood flowing through the vessel causes acceptable stress on the inner walls of the vessel, the endothelium. Here we can just see a little illustration of the shear stress caused by the blood flowing under pressure. Artery walls that are constantly stressed by blood flowing at high pressure are more likely to sustain injury, which means that high blood pressure, interestingly, can promote arteriosclerosis or hardening of the vessels as well as result from it. Endothelial cells produce a natural molecule called nitric oxide, or NO, which reduces blood pressure at the local level when the increased blood pressure is detected by the endothelial cells. The nitric oxide just works for a few seconds, and so shortly after, more has to be produced to keep the vessel walls relaxed, dilated, allowing for nutrient-rich blood to flow to the tissues and organs downstream. And here we have an illustration of the all-important nitric oxide molecule, or NO for short. This is an illustration of a cross-section of an artery. The endothelium is the yellow section there, and the shear force of the blood is having a direct effect on the endothelium, and nitric oxide, depicted there in green, is being produced. This in turn causes the smooth muscle on the other side of the endothelium to relax. This lowers the blood pressure locally and helps to ensure that the blood flows through the relaxed vessels to vital tissues. It is worth noting that nitric oxide is not nitrous oxide, the gas used for inhaled pain relief at the dentist, or laughing gas. In an earlier slide, we saw the cross-section of the artery, the blood flow under pressure, and the endothelium picking up on that, releasing nitric oxide, which relaxed the smooth muscle. It is well recognized that the endothelium-dependent dilation is compromised in the blood vessels of patients with cardiovascular disease. Endothelial dysfunction plays a key role in the development of cardiovascular disease. The question is, why is the endothelium dysfunctional? The question is, why is the endothelium dysfunctional in certain circumstances? Here I use my mnemonic ox and tail. Basically, the endothelium is dysfunctional because it is being badly treated for various reasons which I will elaborate on. Healthy endothelium is anti-atherogenic, so reduces plaque, anti-inflammatory, and vasodilatory, which means relaxing the tone or tightness of the vessel. So I just would like to discuss 5 things here: oxidation, tone, activation of platelets, inflammation, and leukocyte, which is also white blood cells. So you may well ask, what is oxidation, and why does that concern us? It is a reaction in which a substance gives up an electron, which is part of its energy, as when it combines with oxygen. An example of fast oxidation is burning. An example of slow oxidation is rusting. I mentioned earlier that bad LDL cholesterol molecules were prone to being oxidized. So they lose an electron, part of its energy, and this makes them irritable, for want of a better word. They are more foreign looking, and so they are gobbled up by the white cells, which are also called leukocytes. They're sneaked into and through the endothelium, starting plaque. It is worth holding on to these little concepts as we briefly discuss what can throw the all-important endothelium out of sorts and the ensuing chaos of damaged blood vessels. Back again to our little mnemonic. The main things that can cause the endothelium to be dysfunctional: oxidative stress, like rusting or the slow burn, leads to chronic inflammation. It damages endothelial cells, leads to vessel damage and subsequent tissue damage. And regarding the tone or tightness of the vessel, the endothelium makes vasodilating nitric oxide. High blood sugar reduces nitric oxide production. Patients with diabetes have decreased nitric oxide levels, so their vessels are prone to being quite constricted. This causes raised blood pressure and limited blood flow to tissues and vital organs. If platelets are activated, then they're more prone to causing thrombus, clots, which can cause the fatal blockages. Then chronic inflammation. High blood sugar triggers endothelial damaging inflammation. This leads to plaque formation, atherosclerosis. Leukocytes, which are the white blood cells, activated leukocytes increase oxidative injury to the endothelium. Here we have a cute little cartoon illustrating the activation of platelets, and nitric oxide helps to prevent the platelets from being activated. We have them here deciding that they're going to sit together, be activated, and try and form a clot. And the nitric oxide says, how about no? And the platelets aggravation are thus inhibited. Exercise has a positive effect on nitric oxide levels. If somebody has a very sedentary lifestyle, such as the gentleman here illustrated in the left-hand slide, their nitric oxide levels will be low, whereas if somebody takes moderate exercise, their nitric oxide levels will be elevated. This will have the net effect of keeping the blood pressure or reducing the blood pressure to a normal level, which is a good thing long term. Studies have shown that laughing raises the nitric oxide levels in our blood, and so this is ultimately good for our cardiovascular systems. So, just to recap, the net result of endothelial dysfunction over time is atherosclerosis. Endothelial dysfunction is precipitated, just to recap, by such factors as high blood sugar, which leads ultimately to atherosclerosis or hardening of the arteries, causing the macrovascular complications of diabetes. Certain traits or habits may raise or lower a person's risk for developing atherosclerosis. These are called risk factors. The more negative risk factors a person has, the more likely they are to develop atherosclerosis. Many risk factors can be controlled, helping to prevent or delay atherosclerosis. The question is it worth modifying one's risk factors? Research, for example, the STENO-2 study, showed remarkably that when all risk factors were managed optimally, in patients with type 2 diabetes, there was an incredible 50% reduction in cardiovascular events. Large landmark trials such as DCCT and UKPBS revealed a legacy effect, convincingly demonstrating that tight control of blood sugar is beneficial, reducing microvascular complications. The studies demonstrated sustained benefit with respect to cardiovascular disease outcomes long after the trial was over. So essentially, patients with diabetes who control their blood sugar well, even if only for the first 10 years after they are diagnosed, will reap the benefits years later. And here we have an example of a poor gentleman who has been making poor lifestyle choices for quite some time, choosing obviously junk food and smoking, and the result is the very large abdominal girth, and you can only imagine that the damage he has done to his blood vessels over time also is pretty severe. So here on the left hand side we have an illustration of a gentleman who really is showing a whole load of risk factors at the same time. He is sedentary, obviously he's just flopped in his chair. He doesn't even stand up to get the television to change the channels because he has the zapper just to his right. He's eating pizza, he's already gone through half of it. He's smoking, and he has already gone through several because you can see the ashtray is full. And he is on at least his second can of beer. He is demonstrating so many risk factors that may ultimately lead him to severe cardiovascular disease. The young girl on the couch. This is quite a disturbing image, really. She's very young, she's very obese, she's not active, and she is eating junk food. She is horsing into pizza, and the drink on her lap is obviously not even low sugar. It looks like a full sugar Sprite or 7-Up, and she is not exercising. She's just obviously just sitting, having a little party for herself. This illustration shows modifiable and non-modifiable risk factors. So non-modifiable risk factors we cannot change, but the modifiable ones we can change and make a significant difference to our predilection for cardiovascular disease. This is a list of non-modifiable risk factors, and We can just remember the letters S, A, F and E. The sex of the patient: males are more prone than females up to menopause to develop cardiovascular disease. Obviously the age of the patient, we can't change it, but the older a person is, the more likely they are to develop cardiovascular disease. Family history: if somebody has a family history, a first-degree relative who has cardiovascular disease, they're more at risk. And then a person's ethnicity: if somebody is of South Asian origin, for example, they're more prone to developing cardiovascular disease. Here we have a list of the modifiable risk factors. Smoking and passive smoking are risk factors for coronary artery disease. Stopping tobacco use can reduce the risk of cardiovascular disease significantly, no matter how long a person has smoked for in the past. Persons who are overweight or obese are much more at risk of developing cardiovascular disease. Lipids: somebody has high cholesterol and lipids in the blood, that really is a predisposing factor for developing cardiovascular disease. If the diet then is high in saturated fat, this will increase the risk of heart disease and stroke. According to the World Heart Federation, it causes 31% of coronary heart disease and 11% of stroke worldwide. Moving on then to illicit drugs. Cocaine, amphetamines and ecstasy, among others, all affect the cardiovascular system directly. In fact, cocaine researchers call cocaine the perfect heart attack drug. Cocaine users, their aortic stiffness is increased by 35% and their blood pressure by at least 8 millimeters of mercury. Exercise, I'll elaborate on that shortly, but to have ongoing moderate exercise regularly through the week, that actually really helps to reduce a person's predilection for cardiovascular disease. Then we come to aura, which is for raised blood sugar, raised blood pressure and raised clotting tendency. Raised clotting tendency means increasing the coagulability of the blood and their tendency towards producing clots. So in that situation, person may be recommended aspirin. I'll go on to that in one of the next slides. The lady at the bottom left of this slide, she looks very depressed, and she will have a raised likelihood of developing, she'll be at risk for developing cardiovascular disease, as will the gentleman on the lower right slide. He's got a lot of rage and stress in his system, and he is going to be at increased risk of cardiovascular disease. Evidence-based guidelines recommend the following to modify risk factors and reduce cardiovascular disease. Weight loss. It is recommended that obese patients have steady weight loss of 5 to 10% per year until reaching their optimal weight. The diet. It shouldn't be the junk food that we've been looking at in the previous slides. Healthy eating styles such as the Mediterranean diet, which emphasizes eating primarily plant-based foods such as fruit and vegetables, whole grains, legumes and nuts. Butter should be replaced with something such as olive oil or the healthy fats. The Mediterranean diet also recommends using herbs and spices instead of salt to flavor food. The diet also typically includes red wine, a moderate amount, and the Mediterranean diet will always recommend that trans fats be avoided because they're so atherogenic. The exercise regime that is recommended would include at least 150 minutes of moderate exercise per week or 90 minutes of high intensity per week. to help reduce cardiovascular disease. Smoking cigarettes remains the leading preventable cause of cardiovascular disease. More than 50% of heart attacks among middle-aged women are secondary to cigarette smoking. The blood pressure. This should be checked every clinic visit and should be at least 135 over 85 or 130 over 80 in selected high-risk groups. Lifestyle advice should be adhered to, and if the blood pressure is not settling, medication needs to be started. Patients may need several agents to help normalize blood pressure, but this is such a very high risk factor. It is crucial that normal blood pressure be attained and maintained over the person's life. Regarding dyslipidemia and statin treatment, according to guidelines, patients with diabetes should have their lipid levels checked annually. All patients over the age of 21 with any form of cardiovascular disease should take statins. So too should all patients with diabetes who are between the ages of 40 to 75, even if they do not have evidence of cardiovascular disease. Aspirin is recommended to help prevent heart attacks by reducing the blood's tendency to clot. It is recommended that it be commenced in males if they're over 50 or in females if they're over 60. It should be started earlier if the patient has another risk factor other than diabetes for cardiovascular disease. It is contraindicated in patients under the age of 21 or who have a bleeding tendency, aspirin allergy, or a history of liver disease. Then regarding the level of blood glucose that one should try and attain in order to help prevent cardiovascular disease, macrovascular disease down the line. In newly diagnosed cases of diabetes, one should aim for a HbA1c, which is the weighted average over 3 months of blood sugar. Aim for 6 to 6.5%. If this is achievable without hypos. The general target should be for less than 7%. If advanced complications are present or in the elderly, one should aim for 7.5 to 8%. If a patient regularly has hypos, aim for 8%. And here we just look at the trends. The number of overweight people or obese people in the world has increased. People are getting more obese than ever. Fewer people are aware of the causes of heart disease. Most people with high blood pressure are still not controlling it, and approximately 1/3 of adults are still smoking every day. Statins, blood pressure medication, aspirin, and of course drugs to reduce blood sugar are all crucial for modifying a person's risk factors for developing macrovascular or cardiovascular disease. And here we have a summary of the goals for risk factor management in patients with diabetes to help prevent macrovascular disease. It also has the goal of the therapy and the recommending body. We have discussed the causation, prevention, and hopefully reversal of cardiovascular disease. We would do well to recall the words of Hippocrates, who seems to be describing this very problem. He said this over 2,000 years ago. A disease does not occur unexpectedly. It is the result of constant violation of nature's laws, spreading and accumulation of such violations transpires suddenly in the form of a disease, but it only seems sudden. Thank you very much.